Scoliosis comes in many forms, such as congenital, juvenile, and also idiopathic. First, we will be focusing on adult spinal deformity. And a deformity of the spine can either occur in the coronal or the sagittal plane. In the coronal plane, it is defined as the lateral deviation of the normal vertical line of the spine greater than 10 degrees, whereas sagittal plane imbalance is defined as a sagittal imbalance of greater than 5 centimeters radiographically. And you can see that here demonstrated in the illustrations. Commonly, adult spinal deformity occurs at around 60 years of age, and it affects males and females equally. Idiopathic scoliosis is more common in the thoracic spine, and degenerative scoliosis occurs more commonly in the lumbar spine. Degenerative scoliosis is a result of asymmetrical degeneration of disc base and as well the facet joints of the spine. This may occur in the coronal plane, which is known as scoliosis, or the sagittal plane, kyphosis or lordosis. Treatment of adult spinal deformity include non-operative techniques such as oral medications including NSAIDs for pain relief and tricyclic antidepressants, which can be helpful with the sleep disturbances that are associated with the deformity. In addition, physical therapy such as core strengthening can be beneficial, and corticosteroid injections can be both diagnostic and therapeutic. Bracing may also slow the progression and increase the comfort of the deformity itself. Surgical intervention should be carried out in patients that have a large degree of curvature of the spine, as well as a progressive deformity. In addition, if there is pain that is continuous despite the efforts of non-surgical techniques, surgery should take place. The technique used for adult spinal deformity is surgical correction of the curvature, and this is carried out with instrumented fusion of the spine. This X-ray shows an example of a patient who has undergone spinal fusion surgery. We can see here that the surgery uses spinal implants, rods and screws to correct the scoliosis and hold the spine stable whilst the bones heal. Congenital scoliosis is the failure of normal vertebral development during the 4th to 6th week of gestation. Most cases occur spontaneously. However, some maternal exposures have been known to cause scoliosis, for example diabetes, alcohol and hypothermia. Imaging used in congenital scoliosis include radiographs, CTs and MRIs. Radiographs are usually sufficient to confirm the diagnosis in AP and lateral view. However, CT is sometimes useful, and MRI should be carried out in all patients with congenital scoliosis prior to surgery. Treatment includes non-operative techniques such as observation and bracing, and surgical treatment is indicated in patients with a progressive disease.
Thanks for watching, and I hope you found this useful.